Let me just remind you that we will be taking you to Parliament, where Ken Oforiatta, Finance Minister Designate, will be vetted today by the Appointments Committee of Parliament. As soon as that begins, we'll be there live. Now, as the world marks Tuberculosis Day today, Programs Manager for the National Tuberculosis Control, Dr. Yao Eduse Poku, has told JoyNews the country's detection rate has dropped by a whopping 15% as a result of the pandemic. In the year 2019, the Ghana Health Service recorded over 14,000 cases of tuberculosis. However, the outbreak of COVID-19 in 2020 negatively impacted its detection and diagnosis, bringing the number of detected cases to 12,000.
We put in one of the best strategies in the world in late 2019, and we had a lot of cases. So by the end of 2019, we had gotten about 14,600 TB cases. That was quite substantial. It was almost 15,000. And at the beginning of the first quarter, or at the first quarter of 2020, COVID set in. So what happened? People will not come to the health facility. People will, even if they will come, they will not disclose that they were coughing. And you and I know why. Because at that time, it was a high stigma, because people were afraid to be stigmatized that they were having COVID. And as I'm informing you that COVID and TB, the symptoms are similar. Okay, so as a result, patient OPD attendance dropped. And so we could screen less, and the diagnosis, people that we diagnosed, we got about 12,433 as a result of that. And mind you, in some countries, TB cases fell more than 20%, but for Ghana, it was about 15%.
Now, speaking at a press briefing to mark the day, Dr. Eduse Poku further explained that the result of a pilot study conducted between January and March in the Greater Accra region showed that testing for both COVID-19 and TB were positive, as in out of 208 samples, 9% tested positive for TB and 2% tested positive for the coronavirus.
Preliminary results, ladies and gentlemen, from a pilot study in Greater Accra on testing for both COVID-19 and TB at the same time showed that out of the 208 samples tested for both COVID and TB from January to March 2021, 9% of them tested positive for TB, whilst 2% tested for COVID. In fact, it is significant to note that one of the cases among this result was a multi-drug resistant case, meaning the bacteria that were found in the sputum were resistant to our two main first-line medications, that is isoniazid and rifampicin. This clearly shows that anybody with cough, fever, or breathlessness could be having TB.
And speak to Dr. Eduse Poku, whom we heard from earlier. He has joined us via Zoom. Doctor, good morning. Thanks for joining us. My first question would be that how do we know that we are just not recording a lower number of cases? And how do we know that the incidence of tuberculosis on the country is not dropping?
Thank you very much, Daniel. And thank you to Joy viewers. Yes, it's a systematic study that has been conducted, and it's been led by the World Health Organization, and such that we come up with a very good result. So, not at all. It's based on evidence, statistical, combined with OPD attendance. I mean, it is robust. That is what I would say.
Okay. I'm sure this issue is a matter of concern for you. How serious is the situation?
If it is expected that, as the regional director mentioned of Upper West, it is expected that in Ghana, every year we find 44,000 cases per our population that we have, about 30 million population. So if we are detecting less than a third of this, then it's very, very worrying. But there are reasons why this is happening. We need the primary health care. We need to have to resource these primary health centers where and be screened and be diagnosed of TB. Government is doing its best. We have about 132 gene experts that diagnose TB cases, is able to diagnose first-time resistance. And we also have about 55 digital X-rays, but they are not everywhere. Now we have about 260 districts. If we could resource every district to be able to have a gene expert and a digital X-ray, then we'll be doing very, very well getting these missing cases.
Now, Dr. Dusipoku, I understand that you attributed the low incidence of the case or the low reportage of tuberculosis to the COVID-19 pandemic, among other things. Is this the case?
That was last year, 2020. But before 2020, we had put in a very good strategy, one of the best in the world. One, intensify case finding, and then sputum transportation system. It was working till COVID set in. It is said that what I mean by this is this. In the health facility, when a person enters the health facility and the person begins to give complaint as to why he or she has come to the health facility, in addition to all that the person will say, we also want to find out if the person was coughing. Because TB basically affects the lungs. And so by so doing, we systematically ask questions, and then if the person is eligible, the person goes and take a sputum for testing. But we realize that the state-of-the-art machine that we have, that is the gene experts and the digital X-ray, they are not everywhere, as I mentioned. And therefore, we also devised a strategy called the sputum transportation, where people will come to the facility, they will not waste time at all. We will collect their sputum. Where they don't have the gene expert, we will transport it using an external courier to a place where the gene expert is, so that we can diagnose the case quickly. Unfortunately, when the COVID set in, things reversed because the symptoms of TB and COVID are similar.
Right.
And therefore, people were stigmatized. They were afraid to mention that they were coughing, and so we lost a lot of patients.
Right. Dr. Dusipoku, thank you very much for joining us this morning. All the best in the fight against TB. It's a fight for us all.